Hi guys. Hello everyone. Thanks for joining in. I hope you all are keeping safe in the pandemic and I hope you all are still taking precautions. Hi. Thank you so much. And thank you so much for joining in, for all the lovely comments, and of course for joining in. Today's live session is something which is different from what I usually do. And it is not just a session where we're going to talk about something very important, but it's also going to be a session which you're going to take a lot of knowledge back from. And definitely watching this session is going to help you understand all about lung cancer. This will not just help you in understanding when it can be detected at an early stage, how you can prevent it, but you're also going to get the chance to talk to somebody who is a pioneer in this field. November is the Lung Cancer Awareness Month. I posted this yesterday on my story, and I'm so elated and so happy to be associating with Dr. Arvind Kumar, who is the chairman at Institute of Chest Surgery, Medanta Hospital, in his new campaign for lung cancer awareness. Now we've seen a rising, there've been like a crazy rise in the cases when it comes to lung cancer, and also lung cancer is one of the major reasons for the maximum cancer deaths in India. And this is why we decided to come together on this live session to help you guys understand all about lung cancer and spread as much awareness as we can for all of you. And I'm sure that this will not just help you, but it will also help your families, your children, or even the elderly. And you could spread this knowledge across to your friends and family members. So without wasting much time, I would like to start with this live session, and I would like to invite Professor Dr. Arvind Kumar. Will give a quick introduction about him once he joins in. And he's here. Sir,
Hi, good evening.
Professor Dr. Chairman Surgery Vedanta. He really is a pioneer in this field and has won awards for all the tremendous work that he's done. So it's a great pleasure have talk to the audience, back to the audience. We could tell them as to why we're doing it.
Sana, I'm sorry I couldn't hear you because your voice seems to be cracking. I don't know if the problem is at my end or your end. I can see you clearly, but the voice is cracking.
Okay, it could be because of the placement of the camera. I'd like to repeat
Yeah,
myself.
yeah, now
And
it's clear. Now it's clear. Thank you
I would
so
like
much.
another opportunity to just introduce you quickly for all those people who are writing on the comment box that they couldn't hear me. This is
Sure.
Professor Dr. Arvind Kumar, and he is the chairman at Institute of Chest Surgery, Medanta Hospital. And so it's truly a pleasure to have you on board because we're so actually elated that you are initiating this campaign for lung cancer awareness. And I could have the pleasure to have a live session with you to help get the audience aware about what's happening around is really a pleasure for us. And thank you so much, sir. Would you like to talk a little bit about why we are doing this?
Yes. Sana, first of all, thank you so much. Good evening to you and good evening to all the friends from across the world who are with us in this program. The reason why a particular month has been allotted to discussing, talking, and increasing awareness about lung cancer is that last 10 years or so, this particular cancer is rising very rapidly in incidence in our country due to various reasons. And I'm sorry to say that today, it's a very shocking information which I'm giving, that today in most of the metros, in terms of incidence, it is the number one cancer amongst males and is also sadly rising in incidence in women also. And there are various reasons. Earlier, we used to think that it is only related to smoking, but now our recent data shows that it's not only increasing in incidence, it's also occurring in people at younger age. So earlier, my most patients were in 50s and 60s, and today they are in 40s mainly. Some of them are in 30s also. It's also increasing in non-smokers. Now, that is the saddest part of the story, that 20-25 years back, majority of the patients were smokers, whereas today, half of my patients are non-smokers and 40% of the patients are women who are again non-smokers. So long and short of the story, lung cancer is increasing in incidence, occurring at younger age, occurring in women, and occurring in non-smokers more and more, which is very, very frightening scenario.
Right, sir.
Okay. Sana, I'm
Yeah,
I'm informed that the video from my end is very hazy. So can I take a
yes,
minute
sir.
and I'll just change my location and see if
Ab-
changing location makes it better? Just give me a
ab-
minute. I'm sorry for the
Absolutely.
interruption.
And for all those guys watching, you can also drop in comments. You could ask as many questions to Dr. Arvind Kumar as much as you want to, because this is the right opportunity for you to also have an interaction with him.
Just see if this is better now.
This is better, sir. Maybe you could also just clean the speaker. Maybe that would help too. Yes, sir. That's much better.
Thank you very much for those small but important suggestions. Thank you. Okay,
Yes.
so the clear message I want to give is that today lung cancer is becoming a major problem, and in times to come, we are likely to see more and more of these cases. And earlier, smoking was considered as the cause for it, but in the last 10 years or so, the increasing air pollution has also become a major factor. And the reason is not far to see. If you look at the reasons why cigarette smoke causes lung cancer, it is because of over 40 cancer causing chemicals which are present in the cigarette smoke. And when you look at the contents of the polluted air, you find that many of those cancer causing chemicals are present in the polluted air as well. So the same chemicals are operating. So basically, breathing polluted air tantamounts to actually cigarette smoking. And there is a conversion formula which is available, that 22.5 micrograms of PM2.5, which is a very fine size particulate matter, is equal to one cigarette in terms of damage to our health. And in Delhi today, the PM2.5 is more than 300. So therefore, everybody who's breathing in Delhi's air today is smoking 10 to 15 cigarettes, whether you are a smoker or not. And I think this is the reason why we are seeing lung cancer in so-called non-smokers, because truly speaking, I think at least in North India, there is no true non-smoker. You are a smoker, Sana. I am a smoker, although both of us have never touched a cigarette.
My God. Wow. That was quite a lot of information, because I had this question, what I would ask you this question, and you proceeded with the line that I don't smoke, I'm still at a balance. And I think you already answered that for me.
Yeah, yeah.
Okay, sir. So, what do you think, sir, would be the right thing to do? Because I think, uh, I mean, what do you suggest? कि किसी को diagnose करना है, and what is the time कि एक ये एक टाइम है जब मुझे डॉक्टर को I should go and see the doctor.
Yeah.
When somebody sees a change in the body or breathing, or what would be
Yeah,
the things?
that's a very good question, Sana, that when should somebody suspect? So first of all, we need to know what is the profile, who is the person who's likely to be a high risk candidate. So earlier we used to say that if you are a smoker above 50 years of age and you've been smoking for 25 years plus, that was the classical group which was supposed to have high incidence. But I'm very shocked, sad to report that in the last 10 years of my practice, this stereotype lung cancer thing story is busted. I have seen 28-year-old non-smoking girl being diagnosed as lung cancer. Just yesterday, we saw a 34-year-old girl from Allahabad who again non-smoker who had a biopsy diagnosis of lung cancer. So what I would say that I would probably put 30 as the cutoff limit, that if you are above 30 and you have two symptoms which are very typical of lung cancer. One is a persistent cough which does not go away, and often people ask what is the duration. So I say anything more than 3 to 6 weeks. And more importantly, if you have blood coming in the sputum, now these are warning signs that there could be something lurking inside. Important thing is that tuberculosis of the lung is also very common in our country, and there also you get similar cough and blood in the sputum. And that is why many times people who present with cough and blood in sputum to doctors are misdiagnosed as tuberculosis and put on anti-tuberculosis treatment, which they take for a couple of months and no response, and then they have a test and they are diagnosed. But by that time, the cancer probably spread. So early diagnosis of lung cancer is important, because if diagnosed at early stage, lung cancer can be cured by surgery. But if diagnosed at late stage, then cure is not possible. We can only talk in terms of control of cancer. And early diagnosis is only possible if we pay attention to this persistent cough and blood in the sputum. And if we do a chest x-ray and it shows a patch, don't presume every patch to be tuberculosis unless we have done some investigation to prove it to be tuberculosis or otherwise. This is very important, and this is the only way we can have early diagnosis of lung cancer. Sana.
So, are there also cases where, like you said, misdiagnosed for tuberculosis? So, in that case, what do you suggest to the patient? Should they be able to identify that this is more than that?
Sorry, Sana, again the voice was cracking.
Sir, can you hear me now?
Yeah.
Yes. So, doctor, my question is, you mentioned that sometimes lung cancer could be misdiagnosed at tuberculosis.
Yeah.
So I want to ask you that how does the patient identify that this is not tuberculosis? Say it has been misdiagnosed.
Yeah. So the one thing is that age. I mean, tuberculosis can occur at any age. So if you have teenager, you are in 20s, and all these things occur. Younger you are, more are the chances that cough and blood in sputum is likely to be because of the tuberculosis. Older you are, more are the chances that it's likely to be because of cancer. Earlier, we used to put 45 to 50 as the cutoff limit, but I think now the limit has come down, because many times we see this in early 30s also. And the way not to miss is, if you have a patient where you feel it could be either way, we need to do sputum test, we need to do, if needed, biopsy. So presuming anything to be tuberculosis may not be right. You do a sputum test. If you find tuberculosis bacteria, well, you know it is tuberculosis. If there is a patch, get a biopsy done. Biopsy shows tuberculosis. Okay, fine. You know it is tuberculosis. But if biopsy shows something else, you know it is. So what happens is that many times we presume everything to be tuberculosis without doing the necessary investigation. That should be avoided. If we do tests, prove it to be tuberculosis, and then you start, then you are sure that you are not missing lung cancer.
Perfect, perfect. And we also have a question from the audience, sir. Um, one of the questions says that you told about the symptoms of lung cancer. However, are there any cases in lung cancer that could be symptomatic?
Are there any?
Are there any cases where lung cancer can be asymptomatic?
Yes, yes, yes. That's a very sad part of this disease, that sometimes the tumor can start developing within the substance of the lung and keep growing without causing any symptoms. And the first symptom that the person develops is from what is called spread of the cancer beyond the lungs to other areas. Well, those are things where not much can be done except something called lung cancer screening. So this has been tested in the USA, that there is a, as I said, there is a profile of people who will have higher chance of developing lung cancer. Typically in US, these are people above the age of 55 years who have had more than 25 pack years history of smoking. So these are people who have a higher chance. I would say in our country, maybe the age group comes down to 40 or so, and the smoking history also becomes less. So if you are a chronic smoker and you are 40, 45 plus, there is a significant chance or good chance or possibility of your developing lung cancer. In this age group, a screening CT scan, low dose CT scan, has been proposed. But the problem, Sana, with this approach is, in our country, now half of the lung cancers are occurring in non-smokers because of exposure to pollution. And you can't subject the whole population to CT screening. So screening can only be confined to those who have history of smoking and are 45 or 50 plus. The rest of the people, that asymptomatic group, there is unfortunately no way of picking up. Yeah.
Okay.
That is a very good question.
Yes. So we have more questions coming in, and I'm going to address them a little later. But first, I want to also talk about air pollution, since you mentioned that right before taking this question, that even in passive, people not, I mean, they're not smokers. Passive smoking is for lung cancer and major reason for this air pollution. So, would you like to tell us as to how we can prevent this to happen? Because air pollution, we have to breathe the air, but are there any precautionary measures to save our families and our children from something such as?
Yeah, Susanna, you have raised two issues. One is about passive smoking, and the other issue you've raised is air pollution. So passive smoking is that if you have a smoker in the house and he or she is smoking and they have a cigarette in the hand, so the smoke which is coming out, which is circulating in the air, and that is inhaled, that accumulates in the air, and then you inhale and you exhale that smoke. So all that coming from you or coming directly from the cigarette, all that smoke remains in the room, and people who continue to be in the room, that's usually the spouse or the children of the smoker. The smoker smokes and goes away to his office, but fills the room with smoke, where the lady and the children continue to breathe for many, many hours, thereby increasing the exposure to that much time. Now, this is what is called passive smoking. You yourself are not a smoker, but you end up inhaling the cigarette smoke because of somebody else smoking. Now, these passive smokers have as high a chance of developing lung cancer as the active smokers, especially because the passive smoke which is not coming through the filter. When the person smokes, he smokes through the filter, but the
Right.
passive smoke is coming directly. So it is more toxic for the passive smoker. So that's one, that those who smoke not only damage their own health, but they also damage the health of everybody else in the family, in the house. This is the passive smoking. The other is air pollution. We have two types of pollutants, the gaseous ones like carbon dioxide, carbon monoxide, ozone, chlorofluorocarbons, all these gases, methane, they are there. And the other is particulate matter, which is divided into PM10, PM2.5, and 1 and others, depending on the particulate size. Now, all these, whether it is chemicals, gases, or particulate matter, through our breathing process, it goes into the lungs and they go into the peripheral most part of the lung, get deposited there, cause damage to lung. More importantly, they get absorbed from there, go into the blood, and through the blood, it reaches every organ in the body from brain to toe. And that's where it causes damage to every organ. So, worst damage comes in children because they have growing tissues, they breathe faster than adults and therefore inhale far more air than adults do, and their growing tissues are more susceptible to harmful effects of air pollution. So the worst damage of air pollution is being caused in the group whom we love the most. That's our children. Elderly people are also affected badly because of low immunity and the fact their tissues are old. And we, the middle aged people, are also affected, but more severe damage comes to children and elderly. And I would like to inform all the followers who are with us in this program that air pollution is not an environmental or chemical issue now. Friends, it's a pure health issue. In fact, it's a public health emergency. It's causing immense, irreparable, irreversible damage to the health of our children. And if all of us collectively do not take action to prevent the air from getting polluted, I'm sorry to say, we will be damaging our next generation irreversibly and permanently. Sana.
Right, sir. So a lot of people are really thanking you in the live session for so much information.
If they really want to thank me, then they should start acting as air pollution or clean air warriors. That's why we started this campaign, hashtag I care for lungs. You know, lungs keep us alive. So when we inhale air, lungs extract oxygen, give it to the body. They extract CO2 from the body and give it outside, thereby keeping us alive. But in the process, the poor fellows suffer immense damage because along with oxygen, a lot of obnoxious chemicals also go inside. So lung is an innocent bystander which suffers damage because it is doing something to keep us alive. And the least we can do is to try and make it safe, keep it safe by taking measures which will not damage the lungs. And that's why we've started this hashtag I care for lungs, which basically aims at doing everything that we can to keep the lungs healthy and not doing any of those activities which will damage the lungs.
right, sir. And sir, as a layman, I just want to ask you some simple measures that I can take at home. Say, for example, wearing a mask. That keep me from saving myself if I'm living it. I am a lot of times, and I do realize that a lot of my relatives also suffer from cough and other respiratory problems because of the polluted air. So, are there some simple measures that I can take to wear a mask when I'm moving, or anything else that you suggest that can help us minimize impact of pollution on our lungs?
So, this question is often asked, Sana, that what we can do to prevent the effect of, or rather stop the effect of air pollution on our lungs. Now, what I say is that this question is almost like somebody asking that I'm wearing a white safari. I'm going to jump into a pond which is filled with dirty water. What can I do to keep my safari clean? You know, if you are breathing this toxic air 25,000 times a day, we are inhaling 10,000 liters of air inside in 24 hours. Well, no matter what you do, some damage will occur. All we can do is relative risk reduction. So a lot of people talk about air purifiers. I would take this opportunity to just inform the viewer that air purifier is like an air conditioner. Just as air conditioner needs a certain volume handling capacity of the compressor, the doors, the windows, everything needs to be closed when the air conditioner is used. And air conditioner is affecting only as long as it is working, as long as you are inside the room. The same way, air purifier also needs to have a certain air handling capacity according to the size of the room, number one. Number two, they all have filters inside. And if the air is too toxic, too polluted, those filters get choked very fast. And if you don't replace those filters, then instead of air purifier, it becomes air dirtifier. It actually makes the air more dirty, because when you take out the filter, you find that there is no filter. It's all carbon, 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 carbon. And air was passing through that carbon, probably adding more carbon to the air. So these are issues which people don't go into detail of, and thereby they just think that they have done something good. They haven't. If you keep windows and doors open and air is coming from outside, again, it's not effective. So therefore, air pollution being a public problem, you know, air is a continuous column. You can't have air segmented and divided. And therefore, a few hours, if you are in a room with air conditioner or air purifier, rest of the time you are outside, you're not protected. So I do recommend this to my chest patients who have undergone cancer surgery, lung cancer surgery, COPD, emphysema, asthma. That's a select group which has a very high risk. So even few hours of cleaner air for them is okay. But I do not recommend air purifier, or for that matter, the smoke towers which are being installed, you know, in Delhi with a lot of fanfare. It's a colossal waste of public money. The solution to a pollution problem is in identifying the sources, which is actually use of fossil fuels in the vehicles, the dust which comes from various sources, the fires that burn in every nook and corner, lane by lane of the country, you know, those, the crop burning which takes place in our neighboring states, those are the causes. We need to hit at those causes. Then only the pollution will come down. Till then, mask, air purifier, these are cosmetic measures, but they are not real solutions to this problem. Sana.
So we are not even realizing that even at this moment, causing some sort of damage to the lungs, we are putting we are kind of also, are also responsible in causing this pollution. So I think it is a long term to actually take a pledge, and we to like do this for our next generation. That we kind
Yeah.
of treat air, the impact of air pollution on our lives. And so I think your whatever insights given in this life have been really, really helpful. Uh, some of the questions that I saw in the live session were is it's related to tuberculosis. I don't know how much this is related to lung cancer, but one viewer is asking tuberculosis occur again after full treatment.
Well, theoretically, anybody who has had a full treatment, there is a possibility. I mean, I won't say that it cannot recur, it can recur, but most of the times, if it has been treated adequately and has got cured, it should not. But sometimes it can, in which case the symptoms will recur and you need to reconfirm the diagnosis. And if confirmed, then you need to retreat it.
Right, sir. And so another viewer has asked if wearing a mask is healthy for us.
Sorry.
Wearing a mask, since we are wearing a lot of masks these days, anytime we're wearing a mask, is that healthy for us and our tongue?
So masks are being worn for two different reasons. Last 1.5 years, we have been using masks as a prevention for corona. So corona, the reason is different. Corona now we know spreads by aerosol. So when I'm speaking, there are some small droplets which are coming out of my mouth. If I'm a corona positive patient, then those droplets will contain the virus, and anyone who is in close vicinity who inhales those droplets will take the virus, and the virus will infect him. So that's how it spreads from one person to another. If I wear a mask, depending on which mask it is, whether cloth mask, surgical mask, or N95, some or all of that aerosol is contained within the mask. So I infect the environment less. And if the other person is also wearing the mask, then he gets protection. So this is how the mask helps us in corona. In pollution, the surgical mask or cloth mask does not do any good. N95, when we wear, yes, it is able to prevent the particles from going inside. But then, as I said, it has to be fitting properly, worn properly. You know, your nose, mouth, chin, everything has to be covered, and it has to fit the mouth, the face properly. If you have loose hanging mask, it's a cosmetic thing you are doing, because the air is passing from the side. If the air is passing from the side and not through the mask, you are not getting any protection. And unfortunately, I have seen a large number of people wearing a mask over the chin rather than face or nose. Now that's no good. So mask helps you, provided you wear it 24/7. And let me tell you, it's not easy wearing a mask 24/7.
Right.
So
Absolutely.
again, mask is okay as a temporary solution, but cannot be a permanent solution to air pollution.
Right, sir. So thank you so much for such an insightful session. And really, um, everybody's writing here that this was a very informative session. And somebody's also written the next thought about the reverse. So really, I think this has been an insightful session for all the viewers. And really would also like to thank you for coming to this campaign. Because now attention to our lungs these days when it comes to lung cancer, air pollution. We don't think about it much. Also, that we won't we kind of hang out with people who smoke, but never really take it seriously in the massive numbers. But as you said, that is, we are at this that the people. So thank you so much, and
Yeah. Thanks to
I
you also, Sana, and thanks to all the viewers for joining in. And I would end by saying that if you think this program was useful, then show your gratitude by sharing this information, because it is only by sharing this information with people across the country, making them aware, making them awakened to this danger, and making them take actions which need to be taken for addressing this problem, will be able to solve this problem. If anybody thinks that government alone should solve it, I think you're mistaken. It's only a people's movement involving all of us across the country which is ultimately going to solve this problem. Otherwise, lung cancer is going to be a real big killer in times to come, and pollution will be one of the major factors for that. Sana, thank you very much. All of you have a wonderful evening.
thank you, sir. And I'm also going to post about the campaign on my story as well as right after the live session. I would like all of you to share it with your family and friends. Swipe up, read about it, and spread information around. It's so important and imperative in today's life.
Thank you.
Thank you. I hope you all enjoyed this interactive session with Dr. Arvind Kumar. He's really a pioneer in his field, and we don't want to reach a stage when how coronavirus, when it just spread like fire, is when everybody started posting videos about what we should be doing, how we should be curbing the impact and effects and all of that. So I think this is the right time to take these measures and spread the information across with all your family, your friends, and as and how I post this next story with a link, I would want you guys to swipe up, check out the link, check out the details. It mentions all about lung cancer, its impact, how it can be diagnosed, and all of the other information which is required. And you can share it with your family and friends, post it on your stories, post it around, so it becomes this. So this campaign can become big, because it is really for the benefit of you, benefit of me, and benefit of others around. Thanks so much. I hope you all enjoyed this live session. Take care. Bye.